What is Sjögren's syndrome? Sjögren's syndrome is an autoimmune disease. In simpler terms, this means your body's defense system, which normally protects you, mistakenly attacks healthy parts of your body. In Sjögren's, the immune system targets the glands that produce moisture, specifically tears and saliva. This leads to the hallmark symptoms, dry eyes and dry mouth. While these symptoms might seem minor at first, they can significantly impact your quality of life. Imagine struggling to swallow food due to lack of saliva or experiencing constant eye irritation. Sjögren's can also affect other parts of the body, causing fatigue, joint pain, and even problems with organs like the lungs and kidneys. It's a complex and often misunderstood condition. Types of Sjögren's syndrome. There are two main types of Sjögren's syndrome, primary and secondary. Primary Sjögren's occurs on its own, meaning it's not associated with other autoimmune diseases. This is the type most people think of when they hear about Sjögren's. Secondary Sjögren's, however, develops alongside another autoimmune disease, such as rheumatoid arthritis or lupus. In these cases, the symptoms of Sjögren's can sometimes be masked by the other condition, making diagnosis more challenging. It's important to distinguish between the two types because the treatment approach may vary. For instance, managing the underlying autoimmune condition in secondary Sjögren's is crucial to controlling the symptoms. Causes of Sjögren's syndrome. The exact causes of Sjögren's syndrome remain a mystery. Researchers believe a combination of genetic predisposition and environmental triggers is likely at play. This means that some people may be genetically prone to developing Sjögren's, and certain environmental factors can then trigger the disease. These environmental triggers are still being investigated, but potential culprits include viral infections, hormonal changes, and even exposure to certain chemicals. It's important to note that these are just potential triggers, and more research is needed to establish a definitive link. While we may not have all the answers about what causes Sjögren's, understanding the potential contributing factors can help guide research and potentially lead to more effective prevention strategies in the future. While the exact causes of Sjögren's remain unclear, several risk factors increase your likelihood of developing the condition. These include being female, as women are 9 times more likely to be diagnosed than men. Age is another factor, with most diagnoses occurring after age 40. Having a family history of autoimmune diseases like lupus or rheumatoid arthritis also increases your risk. This suggests a genetic component to the disease. If you have any of these risk factors, it's important to be aware of the potential symptoms of Sjögren's. Diagnosing Sjögren's syndrome can be challenging, as its symptoms often mimic other conditions. Doctors use a combination of methods, including physical exams, eye tests, biopsies of salivary glands, and blood tests, to detect specific antibodies associated with the disease. Unfortunately, there's no surefire way to prevent Sjögren's syndrome. This is because we don't fully understand what causes it. However, there are steps you can take to manage your risk factors and potentially reduce your chances of developing the condition. Maintaining a healthy lifestyle is always a good place to start. This includes eating a balanced diet, getting regular exercise, and managing stress levels. These practices can boost your immune system and improve your overall health, potentially reducing your risk of developing autoimmune diseases. If you have a family history of autoimmune diseases, talk to your doctor. They can provide personalized advice based on your individual risk factors and may suggest regular checkups to monitor for any signs of the disease. Sjögren's syndrome, an autoimmune disease primarily affecting moisture-producing glands, can significantly impact daily life. While we don't yet fully understand its causes, research suggests a complex interplay of genetics and environmental triggers. Diagnosis can be tricky due to its varied symptoms, often mimicking other conditions. While currently there's no guaranteed prevention, maintaining a healthy lifestyle may play a role in managing risk factors. Early diagnosis is key for effective management. If you experience persistent dry eyes and mouth, don't hesitate to consult your doctor. Remember, Understanding your body and advocating for your health are crucial steps in navigating life with Sjögren's.